Welcome to the We Level Up Treatment Center video series. In today's video we will discuss alcohol withdrawal timeline symptoms, stages, syndrome, medication, risks and AMP, treatment options. When you stop drinking, alcohol withdrawal timeline symptoms like jumpiness, tremors, dehydration and AMP, anxiety can be expected. The severity of alcohol detox withdrawal treatment can be felt within hours of discontinuing drinking. Alcohol withdrawal symptoms happen when someone who has been drinking too much alcohol regularly suddenly stops drinking. The more a person drinks regularly, the more likely they will develop alcohol withdrawal symptoms when they stop drinking. According to the National Institute of Health, alcohol withdrawal symptoms include difficulty sleeping, alcohol cravings, reduced energy, and feeling depressed or low. When does the timeline for alcohol withdrawal symptoms begin? In most cases, withdrawal from alcohol mild symptoms may begin to develop within hours of the last alcohol beverage consumed. Alcohol withdrawal has a broad range of symptoms, from mild tremors to a severe condition called delirium tremens, which results in seizures and could progress to death if not recognized and treated promptly. What are the major alcohol withdrawal timeline symptoms? Alcohol withdrawal timeline symptoms describe what happens to your brain and body when you get dependent on alcohol and stop suddenly. Likewise, the alcohol withdrawal timeline examines the signs of alcohol withdrawal. When searching for the timeline quit drinking and the time frame for symptoms of alcohol detox, you will note the symptoms are the same. If you or a loved one is suffering from alcohol withdrawal, begin by learning more about the withdrawal process. Discover what to expect from alcohol withdrawal treatment along with which therapies are suitable for you. Explore the alcohol withdrawal timeline symptoms and potential effects of alcohol abstinence. Learn what delirium tremens, DTs, are plus the effects of alcohol withdrawal on mental health. Keep in mind that alcohol detox should consider that alcohol withdrawal can be uncomfortable, risky, and even lethal without proper professional detox treatment. More so if the patient is a heavy drinker for a longer period of time. Alcohol withdrawal symptoms include anxiety, tremors, sweating, and nausea. More severe alcohol withdrawal symptoms include fever, mental confusion, and seizures. The safer method to detox from alcohol is under properly supervised medical alcohol detox treatment. What you need to know about the 3 stages of alcohol withdrawal. Although most people won't go through all of the different phases of alcohol withdrawal, the alcohol withdrawal recovery process can be divided into 5 levels, increasing in both onset time and toughness. While the alcohol withdrawal syndrome typically has 3 stages, some individuals with severe alcoholism may additionally experience tremors and PAWS. Why alcohol detox is important. The initial stage of treating alcoholism is the alcohol detox phase. After beginning detox, symptoms of alcohol withdrawal usually go away within 1 to 2 weeks. But, depending on how severe your alcohol use disorder or AUD is, it may take longer. After that, you can concentrate on different hobbies, therapies, counseling sessions, and support alternatives, among other components of the rehabilitation process. What is PAWS? PAWS stands for Post-Acute Withdrawal Syndrome, which is the set of psychological and physical symptoms that can follow a period of heavy alcohol or drug use. These symptoms can last for days, weeks, and even months after quitting the substance and can range from mild to severe in intensity. Alcohol withdrawal symptoms and how to cope. Your body develops a dependence on alcohol over the course of months and years of use. As you get dependent on alcohol abuse, your brain gradually quits manufacturing some of the molecules that it gets from alcohol. Because of this, it takes time for your body to adjust when you stop drinking. Alcohol withdrawal symptoms like headache, fever, nausea, erratic heartbeat, and hallucinations are brought on by this effect. Alcohol withdrawal symptoms are unpredictable and violent, therefore it's crucial to detox under a doctor's supervision. You can get numerous drugs from treatment staff at a residential rehab facility to assist you to manage your withdrawal pain. This enables you to concentrate on healing and improving. What are alcohol withdrawal timeline symptoms? The first step in overcoming an alcohol use disorder is to successfully complete a detox. First, the individual must thoroughly purge alcohol from their body. Long, long-term alcohol consumption causes the brain and the entire central nervous system to become accustomed to its presence. Therefore, as the body and mind quit drinking alcohol, certain withdrawal symptoms are likely to appear. The biochemistry of alcohol withdrawal symptom timeline facts. Alcohol is a depressant that lessens the central nervous system's activity. A person's brain chemistry alters over time as a result of drinking alcohol. Alcohol depresses the body, which prompts it to respond by secreting more stimulating substances. This includes the neurotransmitters dopamine and gamma-aminobutyric acid, GABA. Chemical balance is momentarily restored by the production of stimulating neurotransmitters. Here, the body is trying to fight the harmful effects of persistent alcohol use. However, over time, the body becomes tolerant to alcohol. Also, this highlights that in order to have the same intoxication effects, larger doses of alcohol must be ingested. The brain is simultaneously producing more exciting neurotransmitters to keep up with the increased levels of alcohol abuse. As the cycle continues, the person's biochemistry becomes further out of balance. After quitting drinking, the brain temporarily struggles to adjust to the abrupt end. As a result, the brain continues to produce stimulating neurotransmitters. This causes withdrawal symptoms to appear. The dangers of alcoholism withdrawal symptoms timeline. Long-term alcohol addicts are more likely to experience uncomfortable alcohol withdrawal timeline symptoms. Additionally, if not handled under medical care, some withdrawal symptoms experienced throughout the detox process could be fatal. This is why medical and mental health specialists must oversee the alcohol detoxification procedure. Professional help is available to help people safely stop drinking and continue their recovery. Severe effects of alcohol withdrawal and what to expect. Delirium tremens is the most severe side effect of alcohol withdrawal, although they are rare. It can begin 2 to 5 days after your last alcoholic beverage and pose a serious threat to your life. However, less than 5% of people who stop drinking will experience delirium tremens. The effects of alcohol withdrawal can swiftly worsen for people who have a history of lung or heart problems, as well as other medical disorders. Alcohol detox should be under the supervision of a medical practitioner because of the severity of some withdrawal timeline alcohol symptoms. To ensure that things don't become worse, your treatment specialist will be able to monitor your blood pressure and heart rate. Additionally, you can discuss your symptoms and any pain you are feeling with them. Your medical team uses this information to decide which medication will assist ease your suffering. What is the alcohol withdrawal seizure timeline? Alcohol withdrawal seizures typically occur within the first 48 to 72 hours after the individual stops drinking. If a person has seizures due to alcohol withdrawal, they should seek medical attention as soon as possible. What are delirium tremens? Delirium tremens can be extremely frightening and disorienting, and can even be fatal. Alcohol withdrawal timeline symptoms including hallucinations, confusion, anxiety, trembling, and a high fever are indicative of one of the more severe cases. Between 1 and 5% of those who encounter delirium tremens are reported to die. Alcohol withdrawal is likely to occur if heavy drinking patterns are abruptly stopped. This is due to the neurological system depressing effects of alcohol, which impede brain communications and change the way signals are sent and received. This raises the question, is alcohol a stimulant or a depressant? While depressants slow down the nervous system and help the person rest, stimulants stimulate the nervous system and may give you more energy. Alcohol is a drug that has both stimulant and depressive properties. Alcohol may initially act similarly to stimulants, but it primarily slows down the body, making it a depressant. The central nervous system eventually becomes used to the alcohol's presence and accepts it as the new normal. To counteract alcohol's depressive effects and maintain clear neurotransmitter firing, the body goes into overdrive. The brain overheats when alcohol is abruptly removed, which causes withdrawal symptoms to appear. Additionally, if you consume too much alcohol over an extended period of time, your liver won't have a chance to heal. Alcohol liver damage that is severe and irreversible may arise from alcohol addiction. How long do alcohol withdrawals last? Alcoholism is the second most prevalent psychiatric disease, after serious depression, according to the National Institute of Health. 14% of the overall population has had alcoholism at some point in their lives. One of the most typical manifestations of alcohol dependence syndrome is alcohol withdrawal syndrome, or AWS. Alcohol withdrawal syndrome is a collection of symptoms that appears in alcohol-dependent individuals after stopping or cutting blood alcohol level on heavy or protracted alcohol use. Alcohol withdrawal symptoms during the alcohol detox phase can range in severity from minor to life-threatening. The duration and severity of your alcohol use disorder will frequently affect the signs and symptoms of alcohol withdrawal you experience. People who have battled years of heavy drinking, for instance, are more prone to experience severe alcohol withdrawal symptoms like seizures or delirium tremens. It may be difficult for the first 6 hours after you stop drinking, where mild effects could begin to appear. Alcohol withdrawal symptoms like headaches and vertigo will go away on their own in 1 to 3 days, but more severe ones could reappear later if you don't get medication like benzodiazepines or antiemetics right immediately. These withdrawal medications help prevent nausea. Alcohol detox timeline recap. If done without receiving supervised medical detox treatment, the withdrawal timetable alcohol detox symptoms may involve a lot of anger and pain. Untreated and unmanaged symptoms can be fatal. Alcohol detox should take its time because everyone's symptoms fade at their own pace. Although they can last much longer, inpatient detox dangers are typically greatest in the first 3 to 7 days of the alcohol detox timeline. Before moving on to stabilized inpatient or outpatient therapy, alcohol withdrawal may need to be treated for several weeks in extreme situations. Additionally, instances with irregular heartbeats, high blood pressure, and other persistent risk factors may require numerous weeks of inpatient alcohol detox treatment. Alcohol withdrawal is a range of symptoms that can occur when someone who has been drinking heavily for a long period of time suddenly stops or reduces their alcohol intake. Symptoms may include anxiety, shakes, sweating, nausea, vomiting, insomnia, loss of appetite, and sensitivity to light and sound. It's important to seek professional help to manage alcohol withdrawal safely. That's it for today. If you like our video, please let us know. Have a great day.